Awesome. I'm at my kids' daycare, so I have my oldest with me. You know, it's Thanksgiving week. They're out of school, so you may see me like throwing signals.
Hey, we had that last week too with another speaker, so we're used to.
Awesome. What's my time frame?
I got about 30 minutes.
Okay, cool. Hi, everybody. My name is Dr. Lisa Bryant. I don't think I'm going to be able to see you all. Nope, I only see Greg.
Well, they can see you, but
Gotcha.
yeah, they're
Nope.
all virtual right now.
Gotcha. All right, so I'm Dr. Lisa Bryant. I'm a physical therapist here in Brandon, Mississippi. I have my own practice called Reach Therapeutic Solutions, where I practice mobile physical therapy. I travel around Hinds County, Rankin County, Madison County. That's where all my clients are right now. And I take my office with me. I'll show you my little office. That's part of my office. I just take my exercise equipment with me. And my son has one of my favorite toys. Say hi, Jace. That I use with my kids. So I've been having a lot of fun doing mobile therapy. I mainly see pediatric clients, and I'll kind of go into how I chose my patient population and all of that. But I'll back up. I'll just kind of overview what you all have probably already seen in that video talking about physical therapy. I know they went over the definitions with you as to what it is and what we do, assessing illness, preventing disease and injuries, and limiting the effects of those injuries on persons who have, who do acquire injuries, right? So one of the things that we do is at every visit, well, the first thing we do is get an evaluation. So we'll evaluate someone, see if they have need for physical therapy, and based on that evaluation, we'll develop a plan. We'll evaluate them, observe them, create a physical therapy diagnosis like muscle weakness, whatever the case may be, create a prognosis, which tells the expected outcome. How well do we think you'll do with physical therapy? We'll create a plan and create recommendations for that client and also for the persons that will take care of that client. That is a very important aspect that we cannot leave out. You can't just, tell the client everything, especially depending on what setting you're in. For instance, I do mobile therapy, but I also work part-time at the hospital, at one of the local hospitals here. And I've come into, this is something that I've seen, not frequently because the team is pretty good, but I have seen situations where I was educating my patient on what they needed to do when they got discharged, but the information fell through because let's say, the caseworker thought that the client was, coherent, thought they were set, because they were saying yes, yes to all the questions that were being asked by the caseworker may say, oh yeah, they can go right back home. They live by themselves. They can take care of themselves, and not really assess the home environment. So it's a wider scope than what you're doing. I can't get tunnel vision on doing exercises for someone and not think about their environment once they leave, my care, right? So with that being said, again, like I said, at the hospital, let's say someone is on medication and they are loopy, kind of in it and out of it. And I may say, oh yeah, they can go home, but they get home and they don't have anyone to care for them. They don't have any family. They don't have home health, right? So that's a serious situation. And my husband is actually a physical therapist as well in home health. So something that he has seen, one client in particular was sent home because he lived by himself, right? A lot of times we want to return the client to their prior level of function. How were they moving before they got injured, before they got sick, right? So if I say in their prior level of function, they were living by themselves, they could take care of themselves. So I'm like, I'm gonna send them back, to that situation. Well, if they have a new stroke where now half of their body doesn't work, they're not going right back to their prior level of function, right? So just remember that no matter what profession you choose in the healthcare world, don't get tunnel vision on what you do, because your recommendations will affect everything after you see them, right? So my husband actually had a client, the one I was just telling you about, had a new stroke. When the case workers must have come in and asked him how he was doing, he's like, yeah, I'm good. And think about it, a stroke is new to him too. He may not know what his limitations are until the physical therapist comes in to see them, right? So he had to send someone back to the hospital because this person had been at home a couple days. by himself, unable to get himself back and forth to the bathroom, right? Because he can't physically do it anymore. So that's someone who slipped through the cracks of not being properly, progressed through the system, to find out what his real needs are. What, right? So along with the plan and recommendations, I love to give education, because I always tell my parents, if I see your child for 2 days a week or 3 days a week, I only have them for 3 hours of the week out of how many hours in a week, right? So a lot of the treatments that I'm trying to implement with that child, the parent will have to carry out at home. So I can't just, and then think about too, my population is pediatrics. I see some kids in their daycare centers. Mom is and dad aren't even there. So how can they, duplicate what we've been working on unless I send some homework with them? So this is an example of one of the homework sheets that I send. I usually notate what we worked on in therapy session and then how they can implement that at home, right? Say again.
That's awesome.
Oh, okay. I thought it muted when you spoke. So it's very important. We have to give that education to the family. It's a bigger picture, right? So I'm texting parents all the time, developing a rapport with them. And that's something else about the pediatric population. And I'll go ahead and talk about how I got into pediatrics. So I graduated from Jackson State University in 2009 with my bachelor's in biology. Went on to physical therapy school, graduated from the University of Mississippi with my doctorate in physical therapy in 2012. And since then, I've worked at the hospital that I started full time. And once I graduated, started having children, so I went part time. Became privy to the reimbursement rates, and what reimbursement is if I do a service and and my client has insurance, the insurance will pay me for the service that I provide to that client, right? So going directly to the insurance company, starting my own practice, allowed me to go directly, have that direct relationship rather than being paid by an employer, right? So that's adding someone in between that line. So they say, okay, we're getting reimbursed this much, we're going to pay you this much. And when I found out the difference in pay, reimbursement versus what I was getting paid hourly, I was like, yeah, we're going to figure out what I can do to have my own practice, and be autonomous, be in charge of my own schedule. That was really big for me as a mom, as a wife. I have 3 children, 7, 4, and 2 years old. We're small and that we stair step. So going back full time after my first child was pretty difficult. So when I got pregnant the second time, I was like, oh yeah, I'm coming home part-time husband. I don't know if you know yet or not, but I am. No, it was more of a mutual conversation, but I was very adamant about it because I think what switched for me was having to ask my boss if I could go to my son's program. And I was like, no, this isn't living. This isn't how I envision being there for my children in their growing years, right? So anyway, I brought that up because it's a big decision and it's a big chunk of the way I do my treatment, do my therapy, right? As far as starting my own practice, trying to find out all the ins and outs of how to do that. Because there's a lot to it, but it can be done. And once I saw that other people just like me were doing it, I came across a couple of therapists who are mobile therapists who see 20 visits a week. And I'm thinking that versus being paid hourly for someone, okay, we can do this. So that's kind of how I got into doing my own practice. Now, as far as choosing mobile versus, and this may be interesting to some of you all, if you are looking into starting your own practice, trying to figure out if you want to do that, I would say consider the flexibility that you desire. Consider your schedule. Consider, like I said, your work-life balance.
Yeah, we say that with every cluster.
Yeah.
You have to look at, what kind of schedule do you want? Because some people in the health field, they just work weekends and they're off during the week, but they work 36 hours on a weekend.
Exactly.
So, it really depends on what you want to do as far as a family and your life. So what's important to you. So yeah, that's a great point.
Right. And it kind of dawned on me. I remember feeling like, okay, yeah, I make good money working full time at the hospital. And I said, I feel like I'm working to afford a life I can't enjoy. And that was it for me. That was like, okay, well, we got to figure something else out, right? So we both transitioned. My husband took a home health job, which pays significantly more than the acute care, which is a hospital, than outpatient therapy. Outpatient is like the glamorous therapy. It's the one where you do all the exercises, the one that everybody knows about. You break a leg, break an arm, strain a muscle. You go to outpatient therapy, right? So that's where you use a lot of the skills, treatment skills, right? But it pays the least because it's more of a crowded arena. That's where all the therapists want to go, right? So acute care, you pay more. There's more risk involved. Of course, I had a COVID patient the other day, right? So there's more risk involved, but at the same time, there's more pay. But there's also PPE, which you've probably heard of on Grey's Anatomy. It's all the protective gear that we have to put on. We have to put a hat on and a face shield and goggles, gloves, a whole gown, booties on the shoes. Like we're pretty protected, right? So there's a little bit more risk involved. Also, you see a little bit sicker patients, so there may be more manual lifting because I have to get large people up out of the bed, and they see me, I'm 5'1", and they're like, "You're coming to get me out of the bed," and I'm like, I know what I'm doing. Just trust me. So it's a lot of skill. It's a lot of building rapport. It's a lot of having to talk your patients into doing things, especially like depending on the population. Outpatient, not so much. Like they know they're injured. They know they just got a total knee. They know if I don't move it, I lose it, right? But if you think about someone who is sick, who has pneumonia, or who is depressed, maybe from realizing how much they have gone down from their normal, right? That takes more of your personality. That's a big key part of being a physical therapist as well. How well can I communicate and communicate the need of what I'm doing, right? Sometimes you have to lay it on them thick. I'll say, ma'am, if you don't move it, you told me no yesterday. If you don't get up today, you probably won't walk out of here. And that's serious. Like, that's not an exaggeration. I've had that happen to a patient who frequently refused therapy. She was like, well, I'm gonna just get up when I leave here. And I'm like, it doesn't work that way. Your muscles respond to the load that you put on them. So if you don't put load on them, as in getting up and moving, they weaken, they atrophy, they become smaller. That's why you see people who have had a spinal cord injury in a wheelchair and their legs are really thin, but their upper body is really thick because they're using their upper body, but the muscles that they no longer are able to use in their legs shrink because they no longer have to move.
Wow.
So that's just something there. I'll kind of go into pediatrics. I love pediatrics. I've always wanted to do pediatrics. Even when I was in school, I took pediatric elective courses, but I was not fully aware of the how should I say, the setting of pediatrics and how to get into it. Like I said, everybody knows where the outpatient clinics are. You know where the hospitals are. I just did not know how to get into pediatrics. So long story short, I met one of my PT school classmates at an event, and she had already started her own practice. She was pregnant, about to go on maternity leave. And she was like, I was looking for somebody to fill in for me when I'm out. And I'm like, this is perfect. I didn't even have to really, have a history of working in pediatrics to come fill in for her. I was filling in for them doing home health and pediatrics. And so I got to get experience before starting my own company. And then last year, I just I believe in God. So I believe it was the unctioning of the Lord that was pushing me to start my own practice. Not knowing that during COVID, I would not be working at all at the hospital because they cut the PRN people first. They cut the part-time people first so that the full-time people could get all the hours. So the only income I had was from my part-time job. From my practice. So I was like, okay, I see what you did there. Because the timing was not something that I chose. It was very ordered. So I did bring some of my toys that I wanted to show you with, because with pediatrics, you kind of have to get innovative, right? We talked about having to convince someone to participate in therapy. That's on the adult side. Now, I want you to think about little kids who are like, no, I don't want to do what you want me to do. But I know that I have assessed them. They may have been born with developmental delay. They may have had the first few months of their lives where they're lying down in a NICU room, right? Mm-hmm. Our bodies from from the time you are in your mom's stomach, your body is, how should I say, developing reflexes. It's developing in an orderly fashion, right? So that's why kids who are born early don't get the skills that their body, or the reflexes that their body would have developed had they been born at 38 weeks. Because at 38 weeks, I've developed more flexion, I've developed more reflexes that I don't get to. So just being born premature, you're already predisposed to developmental delay, right? So sometimes I have to, how should I say, talk these kids into doing activities that they don't want to do. And I don't know if I can share my screen. Let's see. Okay, it says only the host can share in this meeting.
All right, now you not try.
Okay. Let me, I don't know if I can, I was trying to take you all to my, can y'all see my screen?
I see a picture of you.
Okay, so no.
Rocking the walk.
Gotcha. I think let's try this way. I don't know if it's gonna let me do it. Nah, I'll just tell y'all, go to my Instagram page later, not right now. But my Instagram page is Reach, REACHTS19. That's Reach Therapeutic Solutions. That's where I put a lot of my material on, as far as the treatments that I'm doing, some of the, because I want to be a community advocate too. So it's not just for therapists, right? But let's say if you are a mom who has a child who does not like to stand on one leg, or who has not developed that skill in a timely fashion, I give some pointers as to how to develop that, right? So let's see. I was trying to see if it was going to play a short video. So this child in particular does not want to stand on one leg, but as you can see, once I changed the environment, once I put a toy on the cone and cued her to kick it, she's standing on the other leg, right? So it's not even about the standing on the leg part. She's like, oh, let me kick this down. But so it's like I have to distract her from from the activity that I want her to do. Because some kids, there's also something called defiance, right? So some kids are defiant and don't want to do certain activities. So I have to find a way to get them to do that. I have another child. This little picture just shows the color spots that I use on the steps to get that child to do reciprocal stepping. She wanted to lead with the same leg on each step. So what I did was I catty cornered the colors. So I would say left foot here, right foot on orange, left foot here, right foot on purple. So that way I'm manipulating the environment to get the same activity without giving those direct instructions, because kids are very smart and some of them are very defiant. So we have to figure out ways to do those things. Now, this is a highlight when a parent sends you a video of, look what my child is doing now. That feels amazing. Wow. And this particular child could not push up to all fours. He has a chromosome deletion. And thing about genetic disorders, each one presents totally differently. So a lot of times you don't know what you're going to get until you have that child, right? So think about a parent whose child has a new disorder and they don't know what it looks like. You don't really know what it looks like because it's, not a common one. How can you confidently communicate to the parent that you'll know how to treat that child, right? So at that point, that's when we don't talk so much about the diagnosis, the formal diagnosis, the microdeletion or whatever. I say we're going to assess what that child presents with, what that child is missing, their activities that they have limitations with, right? And that's what we're going to treat. So it does sometimes, well, I'll say a lot of times the diagnosis helps me develop my prognosis and know where the disease process is going, but it is not the determining factor as to what we expect to get in return from activity, right? So with that, that's where the speech comes into play. That's where knowing what to say comes into play, because I have to develop a rapport with families on a disease that we're both new to. So that can be challenging, but it is. So my default in that situation is explaining that no matter what the diagnosis on paper says, I'm going to do a physical therapy assessment, develop a physical therapy diagnosis, and treat that, right? I'm not trying to treat a microdeletion. I'm not trying to treat Down syndrome. I'm treating low tone. I'm treating difficulty walking. I'm treating muscle weakness, right? So that's where that's the difference in a formal diagnosis versus what physical therapy looks like. Are there any questions so far? I can't see.
One thing that the videos we saw before we saw you and what you're saying now, as important as the skills and the education that you have getting into it is, as important as that is, it sounds like the communication aspect is just as important. Being able to, because especially high school students now, they know that they're scared to get up in front of a room of 10 people and present. But we don't do that to be mean. We do it to build communication skills because it's so important in not only your field, but in all fields.
Right, exactly. And a lot of times, if you can, communication is so key. People will sell you on their abilities by how well they speak, and they may not be able to do any of the stuff that they're telling you that they can, right? This is no shade to physicians, but working in the hospital, I have learned some people who I would not want to touch me. And they have the same white coat on as a different white coat, right? So because someone gets the, how should I say, go through the schooling and graduates, doesn't necessarily mean that they're the best at what they do. Of course, you get the baseline knowledge, but of course, a lot of this stuff that I have learned on the job, how to get children to do activities, like I couldn't learn that in school, right? So I said all that to say, of course, schooling is very important, and I think I've already described that. You have to have a bachelor's degree to even apply to PT school, right? And then I believe all the programs at this point are doctorate level programs, so they're 3-year programs. So that's 7 years of college, right? But it's very rewarding. So one thing that I did want to make sure to bring up was to have a plan. I wasted a lot of time and money not having a plan. I went through undergrad, was on full scholarship. I ran track at Jackson State, so I was on full scholarship there. I was actually offered a full track scholarship and an academic scholarship. I took the academic scholarship because I said I knew about how in athletics they can cut your scholarship based on the needs. They might cut yours to recruit someone else. I said, no, if I lose scholarship, it'll be because I didn't keep my grades up, right? I wanted it to totally be on me. So I chose the academic scholarship. You can't have both. So with that, Pell Grants, I got a lot of money back. I blew the money. I wasn't thinking about the cost of grad school. I wasn't thinking about how much it was. I wasn't even looking up the cost of grad school because I was just coasting through undergrad, right? I knew I wanted to do physical therapy around my junior and senior year. Actually, I knew it coming in because I got on the pre-physical therapy track, but I was not focused enough on my post-bachelor degree plan to make sure that I had all my courses. It was my senior year before I realized that the statistics class that I took was not an eligible course for the PT school that I was applying for. You don't want that to happen.
No.
So that's why I say have a plan. Don't just coast and say, I'll figure it out. A lot of times we look at adulthood and career choice as something we decide once we get there. We're like, okay, I'm young now. Let me just live. No, having a plan is very important.
Yeah, well, we were talking about that before you went online, is that we at Madison County Schools, we actually have a 2-year health science program.
Right. That's
your center. And I'm like, if you're even interested in it, you can do that first. It's not going to cost you anything. And we got some great instructors in that are former nurses and former therapists that can really give them insight before, and they also give them internship opportunities even as a high school student.
Right. Oh yeah, that's cool. I have a few people shadowing me now. With my practice, I also have the resident following me. So in physical therapy school, you can do an extra year and become a physical therapy resident in neurology and pediatrics and orthopedics. So the pediatric resident will follow me next year, once a week for 10 weeks. So there are mentorship programs. There are people that you can to. I looked up the APTA, which is the American Physical Therapy Association. If you go to apta.org, there are mentorship applications that you can put in, and particularly minority mentorship applications. So there are only 5% of African Americans in the profession, right? Even
Wow.
though minorities represent 30% of the population, we only represent 20% in applications to physical therapy school and only 15% of accepted students, right? In my class, there were 50 students, 7 African American started out with us, and I think only 4 of us graduated together.
Wow.
So after the first year of PT school, if you don't maintain the 3.0, you can either start over like the next year. So you've lost a whole year if you don't maintain a 3.0, or you're just out of the program.
We have a question from this is Jessica Morrow from Rosa Scott. She's asking what classes would best educate in science, as far as, because she's really interested in being in the health science field. So what classes would be best to take as science, getting into the health science field?
Gotcha. So your biologies, your chemistries, your physiologies, right? The things that teach you about the human body, how cells work, right? All of those. And the good thing about a program, like the pre-physical therapy program at Jackson State, my biology degree included all those courses. So if you have a plan, pick a program that's going to help you in that plan, right? And here's another thing with, let me finish that statement. Have a plan, pick a program that's going to, put you in that direction, but also do research ahead of time. Look at the curriculum that is required from the school that you want to go to. So if you're applying to UMC, you need to get on their website to see what courses are required for application, because that's what happened to me. The program at Jackson State, the form was outdated. So it was relevant at one point, but who's checking curriculums, every year to make sure that it aligns with the local PT school? Yeah. Right. So that's how I ended up taking the wrong statistics course. So go look ahead, always look ahead. It is not going to hurt you. It's only going to help you, even if it's helping you to decide that that's not what you want to do. Yeah. So take the Allied Health 2-year program in high school, and it might say, that's not what I want. But I say, I didn't really know that I wanted to do physical therapy. How I came to know that I wanted to do physical therapy. I know I wanted to work with athletes because I was a former athlete. And I know I wanted to work in the health field because I know the health field is usually pretty stable financially, right?
Absolutely.
So put your passions together and see what you come up with, right? I didn't want to be, but work-life balance was important to me. So I didn't want to be a physician because I was aware of the long working hours, the long work weeks. I am the one who would physically have the children, so I considered that. My husband and I both considered going to med school, but that's not the route that we wanted to take. So it's not just about the high dollar amount. It's about the whole picture. What can give me the most fulfillment? And, and if you have an expensive lifestyle, what you get paid matters. So take it into account, but I guess you also have to prioritize your desires as well. So money may mean a lot. Flexibility may mean more. So figure it out that way.
And I've stressed that all semester. Now, one thing and you talked a little bit about this, so I'm glad you brought it up. We have several minorities that are watching you right now. So as a minority woman growing up in Mississippi, just like they did, what steps can, or what opportunity is there that they might not even realize to be successful? Because obviously you're a great example of the potential that is there for them that they don't even realize.
Right.
And they have more resources now than you and me had growing up. Was like I said, they got a 2-year program in high school. They could, start shadowing now.
Right. Like I said, on apta.org, there is a mentorship application on there, where they'll match you with another minority, that you can shadow. I'm always available, even if I work part-time, so I don't have a full schedule. Usually I work in the school systems. I'm there on Mondays or Tuesdays, depending on my AB student schedule. And then on Thursdays, I see my kids that are in the daycares or in their homes and stuff like that. So even if I'm not available for treatment, I'm available to talk you through some things, or so you have some questions. So I'll give Greg my email and phone number to whoever needs it. And you can, like I said, go on my page, you can follow it. So there are things that you can go ahead and do to start mentoring people. I mean, being mentored by people. You can be, I'll say, virtually mentored. Follow some minority pages. Follow physical therapy. And I'll try to, if you go to my page, message me on Instagram, and I will link you to some other minority, programs or minority pages that are specifically for that, to kind of help in that. I will say, in PT school, they didn't take it easy on us, right? And I don't want to paint a picture as if there were some injustices going on. I don't know. I don't have factual information for that. I am aware of some people who got more help than others. And like I said, we started out with 7. The only people that got kicked out of our program were African Americans. I don't think, I mean, I know that's not because we have this intrinsic, deficit. It's not it's not anything intrinsic to us. I don't think we were treated the same. But it is what it is. If you know what you're up against, I know I'm in the South. I know I can't, just finagle it around and whatever. I know I may have to work harder. I'm okay with that because I'm not comparing myself to my neighbor. I'm comparing myself to what I want to accomplish and what I want to achieve. So it's not about, oh, what didn't happen to somebody else. Okay, Lisa, you're in charge of your destiny. No one can take that from you. There's no magic man, who is holding you back from everything. You can achieve whatever you want to achieve. So don't get distracted by what things look like, what you may not, you may feel like you're not being treated the same as your other classmates. So what? You don't need a handout. You are blessed with a very capable brain and skill set to achieve whatever you want to achieve. So don't even go into it looking as if that you're at a deficit or no, you can do whatever you want to do, right? So, I mean, and then don't listen to a lot of the rhetoric that you hear. I know when my husband and I each were applying to PT school, we kept hearing, it's so hard to get in. It's so hard to get in. And I was like, well, me plus God is a majority. So I prayed about it,
And it is hard to get in. I mean, the UMC PT program is fantastic.
Right.
But,
So
but being able to get in and get through it is going to be a huge credential because it is a very well respected program.
Right. And then with that, the best advice that I received about being in physical therapy school was treat it like an 8 to 5. If you get out of class at 12, have studies time scheduled from 1 to 5, factoring in lunchtime. Study from 1 to 5. Every hour on the hour, take a 5-minute break, but study till 5 o'clock every day. Do that. If you get out at 4, still you can stop at 5 unless you are, because after you've been in class from 8 to 4, you're pretty fatigued. So only do an hour of study, but the next day you have this big chunk of time. Study for the classes that you're going to take the next day, right? So I wasn't like, let's say whatever classes I took on Monday, I wasn't studying for Monday classes. That'll fatigue your brain. Once you get that information, and you can only take in so much at a time in chunks. So once I got out of class on Monday, I was studying for my Tuesday classes, and so on and so on. And as long as I stayed on that schedule, I made straight A's.
Yeah, I was the same way in grad school at LSU, and it was, I got some smart kids in here, but they still don't have any idea what they're up against when they get to that level.
Oh yeah.
All right, we're almost out of time, guys. Do we have any other questions from anybody? That was a good one, Jessica. Some of you future health science people got anything? Because we got kids from Velma Jackson, Germantown, Rosa Scott, and Ridgeland High and Madison Central right now.
Cool. I'm gonna write those down. Velma Jackson, Rosa Scott, Madison Central,
Germantown, and Ridgeland.
Ridgeland. Cool. And what is it? I mean, how did they all get together? I thought I was just talking to Velma Jackson.
Because no, this is a virtual class, and the ones in virtual learning, we have them from all over the district.
Cool.
So I've been virtual with them all semester. So I've only met 3 of these ever in person.
Oh wow.
But yeah, there's a sharp bunch. But yeah, several of them are interested in health science. Do we not have any other questions? Okay, here we go. Okay, this is also from Jessica Morrow again from Rosa Scott. What are some other jobs in health science or she said, do you like, or some other jobs in health science that you think are good ones to get into?
So again, determining what you want to do. Let's say I like physical therapy treatment, but I don't want to go to school for 7 years. Well, you can do it. You can be a PTA. You can be a physical therapy assistant. In
Yeah, I
home
have a
health.
friend that Heinz doing that. It's a 2-year program.
Yep. 2-year program. So you have to do prereqs before that, like maybe 1 or 2 years of prereqs. So at the max, it's about 4 years, but that's what you would, spend time doing a bachelor's of a program. So,
And
yeah,
it's
so
cheaper.
a lot cheaper, a lot less time, and you can still make good money doing it. Like in home health, we know some people that make $80,000 and $90,000 doing. I know, right? Well, before COVID, everything has kind of shifted with COVID, because they did kind of cut, and that's reimbursement rate based, right? That so the Medicare and insurance companies determine how much you'll get paid in a nutshell. But if you have your own practice, you set that number.
Yeah.
So anyway, so there's PTA, there is occupational therapy, there's occupational therapy assistant. So there are CODA programs all over the state as well. So determine how long you want to go to school, look at the career path of those sciences. You can go to UMC's website and go to the school called SHARP, School of Health Related Professions. That'll list all of the ones that they have at that school. So look that up. And
You're Sharp on Tuesday.
are you going to SHARP? You said
I'll show them Sharp on Tuesday.
cool. Yeah, go to SHARP. That'll list all of the programs that they have there. That's another thing, like doing your research to find out what is available, what is out there. Like a lot of times you may not know about it until you get in the setting. It wasn't until I started working at the hospital that I learned about radiology oncology. Like, and they make pretty good money doing x-rays for cancer. Like for cancer patients, it's a whole different set of radiology just for that.
That leads us into the next question too. I'm glad you brought that up. And Beria Ward from Germantown, she's also a business owner at 15.
Wow.
But she is asking, what are your thoughts on being an oncology nurse? Because she is set on being an oncology nurse.
I think it would be a good idea. I would also, how should I say this? I came privy to some information about nutrition and how that affects cancer, right? And then I remember working on the oncology floor one day, and I just happened to ask a couple of nurses about, their knowledge on nutrition, or do they change the diets of these patients? How well are they pushing that change? And they were they gave me this look like, we are aware, but we don't do it yet. So it's like the culture affects, right? Wow. So when it comes to acute care, educating the community on autonomous changes that they can make. If I'm aware that certain foods will help flush cancerous cells, I'm going to be pushing that information.
Oh, big time. But
I think the difference is nutrition isn't heavily studied in school, right? Now you have some osteopathic medicine doctors who study that, right? You have some and there's a rise of it, the natural remedies for cancer and for a lot of chronic diseases, because a lot of things can be changed with diet. So much can be changed with diet, exposure to
bariatric, believe me, yeah,
right.
I've lost 100 pounds.
Wow. So you know how hard it is, and yeah, that's a whole nother caveat. But yeah, so is this the same? This is a business? No, this is the oncology nurse question. Yes.
Yeah, but she is a business owner. But yeah, she's set on being an oncology nurse.
Right. I would say do your own research to add to the education that you'll get in school. A lot of times schools have a tract of knowledge, or how I have been. Let me see if I can draw. If this is a spectrum of your schooling, right? This is only one section. This is the spectrum visual that they gave us for how much a physician knows about physical therapy. Out of all of their knowledge and training, only a little bit of it goes into physical therapy, but it's so deep under the surface. So that's where we come into play, and we learn all this information, right? So the physician knows somewhat about it, but we get this depth of knowledge. Same thing with other professions. Schooling and nursing, you're going to get an overview of everything, a very complete visual, but it's up to you to dive deeper into certain arenas of that. That's what I'm trying to say. So dive deeper into the nutritional aspect of every aspect. I talk to my patients about nutrition. I'm like, if you don't eat the right nutrients, you won't have the right fuel center in your body stored to supply the activity level that you need.
I get
You
this
can
kid off the hot chips.
oh, I know this from an athletic point of view. I told you I ran at Jackson State. When I ate chips before practice, totally different outcome. I could not literally, I could not last as long because I did not fuel my body appropriately. Right.
Yeah.
So I have a very vivid memory of the difference of how I ate before I had to exercise. So yeah.
Do we have any other questions? I know we're almost out of time, guys.
Miss Jasmine has a phone, so whenever the phone rings,
What a good helper.
Oh yeah. He's enjoying being off of school.
All right. Well, and I'll make sure they get your Instagram information. I know you're really busy. We appreciate you taking some time for us today.
No problem.
It's actually been recorded, so every ninth grader in Madison County Schools is going to see this. So
Yeah.
that was some good information. So, and again, thank you so much for coming. If we have any other questions, I'll text you and I'll make sure they get your Instagram information to follow you and get more information on it.
Right. Perfect. And they can DM me and I'll send them my email as well or phone number.
Yeah, we have several of these minority young ladies are interested in following some similar courses. And I think
definitely call me. We can talk.
a great example for them. I think that's awesome.
No problem. Thanks for the invite.
All right. See me at Biaggi's.
All right. We'll be back.